Hi, Jackson Gates here. I feel the need to get this out into the open. So, since March 10th, 2020, I have been in direct contact with Green Shield Canada and the Ontario Association of Children's Aid Societies, OACAS for short, in regard to the Aftercare Benefit Initiative that provides medical, dental, and vision coverage for former Crown wards of the Society between the ages of 21 to 25. During the COVID-19 crisis that we're currently experiencing here in Ontario and in Canada at large, those who turn 25 will still have their Aftercare Benefit Initiative plan expire as per the 25th birthday expiration policy. I have been trying to reason with them and try to get them to not do so because now is not the time to make former Crown wards even more vulnerable than what they are now. I've drafted a letter and I sent it to our Premier, Doug Ford, Andrew Horvath, Leader of the Opposition, the NDPs, OACAS, and Green Shield Canada. The letter is as follows. To who it may concern, this letter is addressed to the various individuals and entities in Ontario's child welfare system and other people of interest. On January 25th, 2020, the coronavirus COVID-19 was first reported in Ontario. Since then, the situation has escalated into a crisis where all levels of government have been shutting down resources, country borders, medical offices, restaurants, colleges and universities, places of entertainment, so on and so forth. Individuals across this province and the country have been instructed to self-isolate as much as possible, and people have actually been let go of their jobs and careers in response of. People with underlying health conditions and the elderly have been contracting this novel virus, and some have died as a result of. Government powers have enacted measures to ensure the safety and well-being of all Canadian citizens. Companies, both big and large, have also been doing their part to ensure safety and well-being. However, a certain group of people have been overlooked and are being affected. On March 10th, 2020, I began the daunting task of reaching out to the Ontario Association of Children's Aid Societies, OACAS, and Green Shield Canada in attempts to receive advisements on how those who are on the Aftercare Benefit Initiative, people such as myself, were going to be affected. This initiative is designed to provide medical, dental, and vision coverage to those who were a Crown ward of the Society but had their court orders expire at the age of 21. This was achieved through collaboration with OACAS and Green Shield Canada. Under ordinary circumstances that don't involve a crisis, the initiative has been set to expire on the recipient's 25th birthday. After dialogue with both Green Shield Canada and OACAS, the expiration order given to Green Shield by OACAS will still be given the day before the recipient's 25th birthday. This is unacceptable. We have a good number of former Crown wards who are vulnerable to this novel virus, and no former Crown ward of the Society should be without medical, dental, or vision benefits during this time. Through a family court order, the province of Ontario legally became mine and other children's legal guardians. There is legislation in place and obligations of CAS entities and government officials to ensure that those bound by the court order are to be protected and served in a timely and efficient manner. People like me did not have the say nor the choice to grow up in a broken system because our parents and or guardians could not. It does not matter how much time has passed. While we are dealing with this public health crisis, no former Crown ward should be losing their benefits regardless of the 25th birthday policy. This is not the time to put them in an even more vulnerable position. I am now calling on the following individuals / entities. Green Shield Canada, Ontario Association of Children's Aid Societies, Andrew Horvath, NDP Opposition Leader, Premier Doug Ford, Official Ontario Government Power, the PCs. I call upon all of you to enact one last measure. The measure is this. Instruct OACAS and Green Shield Canada to leave the Aftercare Benefit Initiative intact for those who are turning 25 years of age until this crisis has been properly and officially resolved. We have an obligation to former Crown wards during the COVID-19 situation to aid, benefit, and access to medical care now more than ever. It is irresponsible to do otherwise. Let's not make these individuals panic or question on whether their medical needs are to be met. That is not a question they need to ask themselves when they are already questioning other pressing matters. Let's do this. Sincerely, Jackson Gates, former Crown ward of the Society and Aftercare Benefit Initiative recipient. I turned 25 on April 10th of this year. And I received the final email from OACAS an hour ago, and it was a very harsh email. So now I call upon the people I just mentioned to open up your email inboxes. You'll find a copy of this letter. Contact me back and try your best to enact one last measure until coronavirus COVID-19 has been resolved. We have a lot of vulnerable former Crown wards with underlying health conditions that if they lose their medical benefits and then somehow or some way contract COVID-19, they're not going to have the access to medical care or benefits that could be the difference between life or death. Let's do right, and let's leave these plans intact until this is over. Thank you.